Welcome back to the channel. Today, we're going to talk about a condition that hides in plain sight, completely camouflaged by the overwhelming, demanding reality of early motherhood. When you bring a newborn baby home, society tells you, and you tell yourself, that you are going to be tired. You expect the sleepless nights, the broken sleep cycles, and the physical exhaustion of feeding a baby around the clock. You are fully prepared to feel drained. But what happens when that exhaustion crosses a biological line? What happens when you are not just sleep deprived, but your body is fundamentally incapable of producing the energy required to function? If you are waking up feeling like you are wearing a suit made of lead, if the room spins when you stand up to get your baby from the crib, and if your heart races simply from walking up a single flight of stairs, you might not just be dealing with the normal tired of new motherhood. You might be suffering from postpartum anemia. This is a highly common, frequently dismissed, and highly treatable medical condition that affects millions of mothers globally. And today, we are going to break down exactly what it is, why it happens, and how you can reclaim your energy and your health. To understand postpartum anemia, we have to look back at what your body was doing for the 9 months before you gave birth. During a healthy pregnancy, your body performs an absolute biological miracle by increasing your total blood volume by up to 50%. You are literally manufacturing extra blood to support the placenta and the growing baby. However, a significant portion of the iron in your body is transferred directly to your baby to build their own iron stores for the first 6 months of their life. You are giving away your own nutritional reserves. Then comes the actual delivery. Whether you have a completely uncomplicated vaginal delivery or a cesarean section, blood loss is an inevitable, unavoidable part of giving birth. A standard vaginal delivery can result in the loss of up to 500 milliliters of blood, while a cesarean section can easily result in the loss of a full liter or more. Add to this the postpartum bleeding, known as lochia, which continues for several weeks after birth. When you combine the massive transfer of iron to the baby during pregnancy with the acute blood loss of delivery and the ongoing postpartum bleeding, you have a perfect recipe for severe iron depletion. When your iron levels drop too low, you develop anemia. But what does that actually mean for your day-to-day survival? Iron is a critical, non-negotiable component of hemoglobin. Hemoglobin is the protein inside your red blood cells that is responsible for carrying oxygen from your lungs to absolutely every single tissue, organ, and muscle in your entire body. I want you to imagine hemoglobin as a fleet of delivery trucks, and oxygen is the cargo. When you are severely iron deficient, you simply do not have enough trucks on the road. Your lungs are breathing in plenty of oxygen, but your bloodstream cannot physically transport that oxygen to your brain, your heart, or your muscles. Your entire body is quite literally operating in a state of oxygen starvation. This is why you feel so unbelievably deeply weak. Your muscles are screaming for oxygen, and they are not getting it. This oxygen starvation manifests in a highly specific set of physical symptoms that go far beyond standard newborn sleep deprivation. The most prominent symptom is a crushing, debilitating fatigue that does not improve even if you actually manage to get a good stretch of sleep. You might sleep for 4 or 5 uninterrupted hours, which is a luxury for a new mother, but still wake up feeling like you have not slept in a week. Dizziness and lightheadedness are incredibly common, especially when transitioning from sitting or lying down to a standing position. You might feel a sudden rush of blackness in your vision, or feel like you need to hold onto a wall to steady yourself. You will likely experience a profound physical weakness, where simply holding your baby, carrying a laundry basket, or standing in the shower feels like an Olympic athletic event. Shortness of breath is another major red flag. If you find yourself gasping for air or feeling winded while doing basic low-exertion tasks around your house, your body is struggling to oxygenate itself. We also have to talk about the physical signs you can actually see and feel. You might notice that your skin looks unusually pale, almost translucent. A very quick way to check for this at home is to pull down your lower eyelid and look at the inner rim. In a healthy, well-oxygenated person, that tissue should be a robust dark pink or red. In someone with severe anemia, it is often a very pale pink or even stark white. You might also experience sudden hair loss. Now, postpartum hair loss is a normal hormonal process that peaks around 4 months, but severe iron deficiency drastically accelerates and worsens this shedding. Another highly distressing symptom is heart palpitations. Because your blood lacks the capacity to carry enough oxygen, your heart has to pump significantly faster and harder to compensate. You might be sitting completely still on your couch, nursing your baby, and suddenly feel your heart pounding aggressively in your chest, racing as if you just ran a sprint. This brings us to one of the most crucial and overlooked aspects of postpartum anemia, the massive overlap it has with postpartum mental health. The physical symptoms of anemia heavily mimic the symptoms of postpartum depression and postpartum anxiety. When you are chronically exhausted, when you lack the physical energy to care for your baby or leave your house, your mood will inevitably plummet. You might feel entirely apathetic, disconnected, and overwhelmed, which are classic signs of depression. Furthermore, those heart palpitations we just talked about, when your heart starts racing for no apparent reason, your brain interprets that biological signal as panic. This can trigger severe, cascading anxiety attacks. So many women are sitting in their doctor's offices, crying, telling their provider they are deeply depressed and having panic attacks, and they are handed a prescription for an antidepressant without anyone ever bothering to draw their blood to check their iron levels. While postpartum depression and anxiety are very real and require serious treatment, we must absolutely rule out biological, nutritional deficiencies like anemia first, because no amount of therapy or psychiatric medication will fix a fundamentally depleted red blood cell count. If you are listening to this and checking off every single symptom on this list, your very next step is to advocate fiercely for comprehensive blood work. Do not let anyone brush off your symptoms by simply saying, "Of course, you are tired. You just had a baby." You need to ask your healthcare provider for two very specific tests: a complete blood count, or CBC, to check your current hemoglobin levels, and a ferritin test. Ferritin is a protein that stores iron in your body's tissues. You can actually have a technically normal hemoglobin level, but a drastically low ferritin level, which means your body is running entirely on fumes and is on the verge of crashing. You need to know both numbers to get a complete, accurate picture of your iron stores. If your blood work confirms that you are dealing with postpartum anemia, the treatment is straightforward, but it requires strategy and consistency. The first line of defense is usually oral iron supplementation. However, iron supplements are notoriously difficult on the digestive system. They can cause severe constipation, stomach cramping, and nausea, which is the absolute last thing a postpartum mother recovering from birth needs to deal with. To maximize absorption and minimize these side effects, you need to follow a few specific rules. First, iron absorbs best in an acidic environment. You should always take your iron supplement with a source of vitamin C, like a glass of orange juice, or a dedicated vitamin C supplement. Second, calcium completely blocks the absorption of iron. You must absolutely never take your iron pill with a glass of milk, a bowl of yogurt, or your daily prenatal vitamin if it contains calcium. You need to separate your iron intake from any calcium intake by at least 2 hours. Third, tannins found in coffee and black tea also inhibit iron absorption, so do not wash your supplement down with your morning coffee. To combat the potential constipation, you must drastically increase your daily water intake and ensure you are eating plenty of fiber-rich foods. Or talk to your doctor about utilizing a gentle daily stool softener. In addition to supplements, you want to focus heavily on rebuilding your stores through your diet. There are two types of dietary iron: heme iron, which comes from animal sources, and non-heme iron, which comes from plant sources. Heme iron is significantly easier for your body to absorb and utilize. If you consume animal products, you want to prioritize incredibly nutrient-dense foods like red meat, organ meats like liver if you tolerate it, dark poultry meat, and eggs. If you are following a vegetarian or vegan lifestyle, you need to focus heavily on dark leafy greens like spinach and kale, lentils, beans, chickpeas, and fortified cereals. However, you must be exceptionally vigilant about pairing these plant-based iron sources with a heavy dose of vitamin C in the exact same meal, like squeezing fresh lemon juice over your spinach salad or eating tomatoes with your lentils, to ensure your body can actually extract and absorb the iron, not in cases where the anemia is classified as severe, or if your body completely rejects oral iron supplements due to severe gastrointestinal distress, your doctor may recommend an intravenous iron infusion. IV iron bypasses the digestive system entirely and delivers the iron directly into your bloodstream. This is a highly effective, incredibly rapid way to replenish your iron stores. Many mothers who receive an IV iron infusion report feeling like a thick, heavy fog has been instantly lifted from their brains and their bodies within just a few days. If your numbers are dangerously low, do not hesitate to ask your doctor if an infusion is a viable option for your specific medical situation. In the most extreme, life-threatening cases of massive postpartum hemorrhage, a complete blood transfusion may be required before you ever leave the hospital. But for the vast majority of mothers experiencing standard postpartum anemia, supplements, diet, and IV infusions are the primary pathway to healing. Recovering from postpartum anemia takes time. It takes roughly 3 to 4 weeks of consistent supplementation before your body can manufacture enough new red blood cells for you to truly feel a significant difference in your daily energy levels. You have to be patient with your body. It took 9 entire months to build a human being and deplete those stores, and it takes time to slowly rebuild build them. Do not push yourself to exercise aggressively. Do not try to perfectly manage a spotless house. And do not ignore the massive biological deficit your body is trying to overcome. Your only job right now is to rest as much as humanly possible. Nourish your body with highly intentional, iron-rich foods, and consistently take your supplements. You are not weak for feeling this exhausted. Your biology simply requires medical support right now. Reclaim your health, advocate for your blood work, and I will see you in the next video.